Now, one of the biggest human trial ever done on omega-3 fatty acids is called the GCP trial, an effort by the Italian doctors led by Dr. Roberto Maccioli. Now, he followed up 11,000 odd patients, followed them up for people who have had heart attack within the first 3 months. They were put on either 4 arms. One was the omega-3 arm, one was the vitamin E arm, one was the omega-3 and vitamin E, and the last one was controls. Now, what is interesting about this trial is they use a very particular form of omega-3 called the omega-3 acid ethyl esters, right? Now, they followed these people up for 3.5 years, and within 3.5 years, they were able to show that the incidence of sudden cardiac death dropped by a tremendous amount of 45%. The CV death dropped by 30%. The overall mortality dropped by 21%, and the non-CV, non-fatal MI incidence dropped by 20%. These are all very fantastic, very good reports, and this was one of the huge study. And again, the omega-3 which was used was 1 gram, and they were using the form which is called the acid ethyl esters form. It's sudden cardiac death, and you understand that sudden cardiac death can be a major problem amongst patients all around the world. Going forward, this was reported in 2019, just last year, in the Journal of the American Heart Association. This is a meta-analysis, marine omega-3 supplementation versus heart disease, and this meta-analysis involved almost 130,000 people. And they concluded, the researchers concluded, that marine omega-3 supplementation lowers risk of myocardial infarction, CHD death, total CHD, CVD death, total CVD, even after exclusion of the very famous trial called the REDUCE-IT trial, which we will not speak about here. And the risk reduction appeared to be linearly related to the marine omega-3 fatty acids, right? This is another trial, again, a very huge trial, reported just this year, early this year, involving almost 500,000 people, and they were able to show that habitual fish oil consumption of in the form of supplementation was able to reduce CVD outcomes and all-cause mortality. All-cause mortality reduced by 13%, and CVD dying from CVD reduced by 16%. This is a recent trial reported in a BMJ just around the corner, just in March this year. Involving another meta-analysis involving something like almost 500,000 people, and in this particular trial they looked at the habitual fish oil supplementation versus the CVD outcomes and all-cause mortality, and all-cause mortality reduced by 13% and dying from CHD reduced by 16%. These are all again very huge data proving that omega-3 really works. This only gets more interesting. The omega-3 index, how does it compare with traditional CHD risk factors? Now, Dr. Christy Alberts also not only looked at omega-3 fatty acids as measuring the omega-3 fatty acids, she also measured many other things. She measured CRPs, she measured the homocysteines, you can see on the graph, on the slide. She measured the total cholesterols, LDLs, HDLs, total glycerides, total triglycerides, total cholesterols versus HDL as a factor or as a ratio, and last was the omega-3 fatty acids. Now, from this slide, you will see that yes, CRP has got some predictive value. If you look at HDL, yes, it has got some predictive value, but look at the levels, predictive value or predictive level of the omega-3 fatty acids. They are much more predictive compared to all the other factors combined for sudden cardiac death. Now, way back when I first saw all this, when I went to Stockholm for the conference, I brought back some omega-3 kits with me, and I did it in some doctors in this country, doctors who are taking PROVAS. So on your right hand side you will see doctors taking PROVAS, the omega-3 fatty acids, and on the left hand side you'll see some the doctors who were involved. I will not mention names. Now you will see the omega-3 index there, omega-3, omega-6, omega-9. Basically the omega-3 index when you do the sampling, it will give you a lipid profile. This is what is known as real lipid profile. It breaks down your your blood into omega-3, omega-6, omega-9, and also saturated fats, and also trans fats. So this is what is known as real lipid profile. And if you can see there, highest to the lowest, that's me, JS. You'll see JS there, and you see JS number 5 there again, JS. What I did was, I was taking omega-3, Provas, 3 to 4 capsules. Then what I did was, I came back, I brought back krill oil, and I took krill oil for 6 months, and within 6 months, my omega-3 index dropped. Then I realized krill oil may be a good oil, but the amount of omega-3 in the krill oil is very, very little. You need to take a lot more krill oil before your omega-3 index goes up. But this is a very good indication, basically to show you the more Provas you take, the more the omega-3 index rises up. Okay, this is a pilot study, not reported. I did it on my own, just out of interest. Now, what I've spoken today, I've been able to show you that a lower omega-3 index is associated with a couple of diseases. Okay, point number 1, the lower the heart disease, the lower the omega-3 fatty acids, the higher the incidence of sudden cardiac death, the higher the incidence of acute coronary syndrome, the higher the incidence of death from all causes. Now, which means all we need to do is to raise our omega-3 index, and you can just measure that very simply by a single finger prick test, and then it will tell you how much of omega-3 index that you have, and we can then reduce the risk or reduction of these diseases by so much. In fact, the study is showing between at least 30% to 70%. Now, it is not only about the heart. When you take omega-3, it's also going to affect every cell membrane right from your brains to your toes, right? Hence, they are now beginning to show that the omega-3 index is also useful as a predictor for loss of cognitive functions, for dementia, for cellular aging. The more omega-3 you have in your cells, the rate of aging will be reduced, and this has been shown through telomeres. Measuring the telomeres, the faster it ages, the shorter it becomes, but omega-3 is able to reverse that. That was reported in 2010 in JAMA. Also depression, and also in dry eye syndrome. So these are and 2019, I just mentioned just now, Robert Bloch's paper on heart failure as well. So these are all interesting times, and I think more data is going to come out how omega-3 as a function within the cell, and you can measure that, and we can then reduce your risk of inflammation and hence risk on developing many other diseases, right? Now, how can you get fish or omega-3 incorporated into your cell membrane? Very simple, eat more fish, right? But when you eat the fish, make sure it's not fried. Steam is always better, and we Malaysians, we tend to fry our fish. And there is a study to prove that if you fry your fish, you're going to destroy the amount of omega-3 which is going to get into your system, and that is not going to be helpful. The other way is, of course, supplementation. And supplementation, you either take a low potency, that's the normal ones, 300 milligrams, or you take the mid potency. But I would probably prefer, as a recommendation, to take the high potency ones, and you must make sure that your omega-3 is in the ethyl esters form. Why? Basically because most of the landmark studies use the ethyl esters form. So that's the reason why I'm recommending. It's all evidence based, right? I know there are various other forms, people are talking about other forms, but the form which was used in all the trials was basically ethyl esters form. Now, what I did differently was, remember Dr. Alexander Leaf? I met him personally, the guy from Harvard Medical School who has passed on. So he is the one who first told me where to get my omega-3. He directed me to a company in Norway called Pronova, right? This is the same facility which gave their stocks for the G6P trial. So I went there, I saw it for myself, the place, and then I spoke to them, and I was able to procure the omega-3 from this particular facility, right? And if you look at the facilities, I went to the whole place, not a single man on On the factory side, everything is controlled, automated. Next, what I did was I met up with Professor Bros Holub. Bros Holub is one of the top 10 in the field of omega-3 fatty acids. He started a company under the University of Guelph from Ontario. The company's name is Nutrasource, where they went on to look at how to certify a good omega-3 fatty acids formula, right? And they came up with the idea of international fish oil standards, where they look at 5 standard criteria to look at, and I then passed on my product called Provas to them in 2012. By 2013, we were able to get the first reports out to show that we got the accreditation from IFOS, the International Fish Oil Standards, and ever since then, every 2 years, we are getting these accreditations, and the latest batch is accredited for 2022.